When we hear these testimonies, we're trying to reach the heart of the people that are in power. And so that's why we're out here. That's what this town hall meeting is all about. So that somebody in high places can let the people in the higher places know that we did not break America. Don't get me started. We're going to all do our part. Because this is a fight that we're all in.
We're the most local trauma center on the west side. I work on the telemetry unit, and we're seeing reoccurring more chronic illnesses because patients can't afford to buy their medications now. So what would budget cuts mean to our community and to our customers that we serve? Also, my mother is a child care worker. She took care of my grandchildren for 9 months. Without the child care program, I would not have been able to take care of my grandkids while my daughter went to the Navy. So we need those cuts not to be put through. We just need your help in keeping our services going.
Good evening, everyone. My name is Charles Wallace. I've been a home care provider for the past 3 years with Addis. Many home care workers are losing hours. I've lost 2/3 of my hours, which means when I lose hours, I'm not able to provide for my 4 children and pay my bills. When my pay is cut, my bills don't stop accumulating. Our seniors depend on home care aides because many of them don't have family to assist them. I am responsible for bathing, grooming, and dressing my client before preparing his meals on a daily basis. My senior depends on me to do everyday tasks that he is unable to do. Budget cuts target home care providers, child care providers, and doors workers, as well as seniors. 12,000 seniors will be kicked off the program and would have to be placed in nursing homes, which cost the state 5 times more to take care of each senior.
About 2 years ago, I gave birth to my 4th son. I was rushed to St. Bernard Hospital. I had an emergency C-section. If St. Bernard had not been there, I would have died. I wouldn't be here today. I would not be up here today speaking before you. I have kind of like a personal, it's very emotional for me to talk about St. Bernard because I was standing on 63rd Street waiting on my mother to pick me up to take me to Northwestern, bleeding to death. I would not be here. My sons would not have a mother. I'm a CNA. I work 2 weeks. I work 80 hours a week. 80 hours every 2 weeks. I'm on a fixed income. I cannot afford. I barely have car fare to work, let alone to the hospital. St. Bernard is my community hospital. My neighbors go to St. Bernard. My friends go to St. Bernard. My sons go to St. Bernard. I go to St. Bernard. My community depends on St. Bernard. I'm here tonight, please, and begging you, please help us keep these doors open.
We all are parents of the Potter's Playhouse. And step up to the mic. I'm just asking that everyone please take heed of the changes that's going to happen. I work for a company called Live Home, which also provides health services, home health care. I can no longer afford to pay my rent. I was a student going to Kenny King for nursing program. I'm no longer to finish my education because it's a domino effect. You can't work, you can't provide, you can't further anything. I'm knowing that these proposed budget cuts will drastically increase co-payments. With the family of 4, $1,921 per month will be the co-pay and it would double. With the family of 3, making $955 per month, the co-pays will almost triple. So I'm just asking that you all please do not take these services away. I have an excellent provider, she works with me, but I know she has a household to take care of and she can't afford to feed her kids. I can't afford to pay her, and I can't make a future for my boys because there's no assistance out there.
I am a foster care provider and a daycare provider. Together we stand, and divided we fall. So if we stand together, we'll win this fight. But if we divide ourselves, well, we won't get anything from it. So we've got to treat them like our own kids. We've got to be concerned about their welfare, their thinking. So all the ones that I had for the 15 years I've been in this business, they love me just like I was their own parent, because I raised them just like I raised my own parent.
For many years, I had a career in a job with benefits. My sister, at the age of 31, had aneurysm. She had 4 brain surgeries at 31. So I left my job with benefits to become her PA. And it's very hard, especially when you have a consumer that has children, young children under 18. I do everything: cook, clean, grocery shop, groom. I don't even think it's enough hours in a day for what I do. And can I pay my bills? I struggle to pay my bills. It is very hard. I hate having to be scared my hours are going to get cut every time there's a reevaluation when I know nothing has changed in her condition. It's hurtful when I'm tired. And that's the reason why I would like for these programs to continue and even get better. Thank you.